Well, it is time for Medical Monday with our ABC News 4 hospital experts. And today we're discussing breast reconstruction surgery using the patient's own tissue. And Dr. Thomas Ham joins us with the details. Good morning.
Good morning.
Welcome. Now let's talk about, it's called autologous breast reconstruction. What is that?
Autologous breast reconstruction. Autologous just means using your own tissue. So an autologous breast reconstruction is where a surgeon uses the patient's own body tissue. The three areas that most commonly used are the abdomen, the buttock, and even the inner thighs.
And so, of course, we're dealing with breast cancer patients.
Breast reconstruction, yes, ma'am.
So why is it better than, what are some of the other types that have been done in the past, and why is this one better?
There are really two main types of breast reconstruction. Again, we're talking about full reconstruction of the breast. Because if you take a part of the breast,
so they had a radical mastectomy where everything's gone.
Yes, ma'am. So implant-based reconstruction, where we use an implant, and then the again, autologous. Those are the two main groups. The advantages that autologous breast reconstruction offers: once you're done with your reconstruction, you're done with the rest of your life. In other words, if you have a 40-something-year-old woman, if you're young, you expect to live 50, 60 plus years. If you have an implant, it's hard to imagine that implant, that artificial device, is going to last
that long,
for 40 to 60 years.
And so you would more than likely have to go back in and do some more work to it.
Right. It's impossible to think that an artificial device is going to be around for and not have a problem with fracture, rupture, hardening, infection. That can always happen. But with an autologous reconstruction, when I use your own tissue to make you a breast, once we're done with the reconstruction, it is a part of your body, it is a part of you, and we're done. You never have to get another reconstruction again.
And that would be only if you wanted to, because I would have suggested sometimes that gravity kind of plays a factor in things. That's with everything with that. So, but it would be optional. If you wanted to do that. Now, who would be a perfect candidate for that?
A perfect candidate is someone who has enough tissue to make a breast. So if I have a woman who's, let's say, small-breasted, maybe like a B, and she has enough abdominal tissue to make a B, then she would be a good candidate. If I have someone who is, let's say, bigger than a B, let's say a D, and she wants to be that size, and she doesn't have enough available tissue, then obviously she needs to decide whether she wants to be smaller, or we can use an implant at that time. But if you have a small person who's a size 2, weighs 106 pounds, you're not going to have an
much
available
to work
tissue.
with.
Right.
Now, for those who do have the extra tissue to spare, so to speak, when you remove it from the other part of the body, is there some scarring involved? Will you know that something has been removed? How would that work?
In general, right. There's always a scar whenever you make an incision or take tissue away. For me, I think the abdomen is the absolute best spot, because when you make the belly flatter, in general, most people aren't complaining.
Exactly.
As long as the scar is kept well, we can make that very close to like a tummy tuck scar. So if you get a good candidate who has enough abdominal tissue, she can look like she's having a breast lift and a tummy tuck
at the same time. That's a win-win situation. Now, what are some of the alternatives to this type of breast reconstruction?
The alternatives would be using an implant. And the implant, now there's new sets of implants that have come out that are called highly cohesive gel implants, sort of like what you hear is now the gummy bear implant. I do like them, although I do believe that they're a little bit firmer than normal. So it does have a very artificial feel to it. But the rates of problems with these implants are lower than some of the newer silicones. So for breast reconstruction, I think it's ideal.
Absolutely. Some great information. So really, if someone out there, if you are a breast cancer survivor and you've been thinking about reconstruction, certainly a consultation would be perfect. And how would they get in touch with you?
They can reach me at my office, which is 884-1400.
All right. Thank you, Dr. Ham. So nice meeting you.
Nice to meet you, too.
Take care. All right. More after the break, so stay with us.